There are many nutritional and dietary advices from experts and quacks alike on how to keep off non-communicable diseases such as diabetes and hypertension. Some work, some don't, leaving their victims with untold scars. I'm Dr. Masi Korir, and on this episode of Health Digest, Sada Hassan brings you one such dietary advice that is helping people living with diabetes. Later on, she sits down with Dr. Daniel Katambo, a physician whose focus is reversing diabetes through diet.
We are very, very happy.
At age 77, Stephen Garia is living his best life, healthier and happier.
Since 1991, I decided I will not be taking jogo.
Chicken.
You know, the unga. Jogo, because that is refined. Any refined food that contains starch easily releases sugar.
In 1986, Stephen Garia Kanyanja had persistent stomach discomfort that would last for a while. He decided to visit a health facility where he was advised to check his blood sugar levels, leading him to discover that he had high blood sugar levels and could potentially have diabetes type 2.
So I was advised to reduce the amount of sugars I was taking. And after that, then I went home. I didn't even need treatment for that sugar problem.
Years later, the problem did not go away and he sought a second opinion from other hospitals. The doctor advised him to change his diet and the type of foods to eat.
So he advised me to be feeding mainly on traditional foods like githeri, sweet potato, arrowroot, bananas, and such. And he said I didn't require medication. All my problem could be treated using diet.
Traditional foods, just like most foods, have sugars, and for a diabetic patient, intake of sugar has to be regulated. Garia was not advised on how he would run his new feeding habits, and nothing changed, forcing him to proceed to Kenyatta National Hospital in 2018, where he was put on medication.
I gave them my history on sugar problems. And then I continued attending clinics, and after a time it was agreed that really what was necessary for me was to attend a course on how I could effectively manage the sugars.
Diabetes Management and Information Center became his rescue, from one course at a time to learning the basics on managing his blood sugar levels without the use of medicines. He later on embarked on intermittent fasting as a way to control his diet and by default his blood sugar.
I started what they call the 16 8-hour fasting. That is, you eat like I was eating supper at 7 in the evening, and then stay in the morning. When I wake up, I just take a cup of water or a glass of water, then stay on until 11. Those are 16 hours. Without taking anything except water. Water that doesn't have the carbohydrates. And then stay from 11 to 1 to 7 in the evening. which is 8 hours. And I continued that way up to around April this year. That's when I stopped.
6 months into controlling his diet, he had stopped all kinds of medication. He was convinced that he could manage his situation.
I went back to Kenyatta and they checked my blood levels, sugar levels, and they found that my blood sugar levels, the HB A1C had dropped from 7% to 4.2, which means I have no sugar problem. But I cannot forget, that if you change the feeding habits, feeding carelessly, because taking more than you really need, I would say that's not proper feeding.
His lifestyle had changed by this time. He was careful about what he was consuming. On average, he cannot partake a meal with more than 75 grams of carbohydrates. Certainly, he cannot measure each component, but he has a keen eye that understands when carbohydrates are too much.
Between 50 grams to 130, you comfortably live without sugar problem and without medication. From 130 to about 225, then you have medication. From then above that to about 300 or so, you have to continue with the medication and the complications like amputation.
Age has caught up with him, but still, at 77 years old, he's able to pace up and down the staircase as well as do a 3-kilometer walk within the neighborhood while catching up with friends.
The other thing I do on daily basis, I have to do some exercise. Every day, I have to walk at least 3 kilometers. At least daily. But that I have done for many, many years, even when I didn't have the sugar problem. It was just like a hobby. You get used to it. And even when I got the sugar problem, then I was encouraged to continue. To be able to manage my sugars effectively, I had to lose about 9 kg. And that is one thing that helped me.
Garia had to do away with some foods if he was to be successful in his journey battling diabetes. Refined foods became his worst enemies. If he has to eat ugali or chapati, the flour must come from a trusted posho mill.
When I eat ugali, there has to be, I make sure there has to be more vegetables than the ugali. And there has to be some protein. What they say, the ugali should be half the vegetables should be half the plate, while the other half will be between protein and carbohydrates. My ugali, I don't like it going beyond, that is the gram carbohydrates. When I eat the ugali, I don't like it to go beyond 25 grams.
I do a lot of reading, maybe watching, if it is in television, if they are teaching on good diet. I'm particular. So I normally tell him what I've realized, what I've had, and when he went for the course and came with that feeding program, I've been following. I always do what his program says, and I've been also following it because it also has helped me.
The process has been life-changing for Ngaruya and his wife. Looking back, he says he has no regrets. He is more comfortable than he ever was.
You have to be determined. The body is yours. The doctor only advises you to how to live longer. But the choice is yours to decide when you want to, if you want to live longer or you want to go. Because if you disagree with the doctor, if you don't follow his instructions, there is nothing he will do for you. His is to tell you, this is what, if my friend, if you want to stay longer, this is what you do.
Okay.
His wife, Hannah Wanjiku, has followed suit in trying to maintain a healthy diet. She is particular on what her husband eats, even when he is leaving their home for a short trip.
Breakfast, I prepare some nuts. He takes some nuts, ground nuts. So I prepare some ground nuts, tea, some food. Maybe from the previous night sometimes. I'll make a bread, I mean a chapati, and some vegetables. Sometimes I can give him a popo, a piece of popo, this much. I can give him a piece of so this is tree tomato, kamoja. Yeah, you just eat one. Yes. This lifestyle we have adapted is the one which is giving us problems. We are not doing anything, but we are just eating without being cautious. I would advise people to eat according to the amount of work they are doing.
For the Ngaruyas, this way of life has kept the doctor at bay. But is this scientifically proven? I sat down with Dr. Daniel Katambo, a physician and an expert in diabetes reversal, to understand how one can manage diabetes through diet.
So diabetes is a condition that has been with us for quite a long time, and it's amazing by even some of the patients that I see do not fully understand in terms of definition of what diabetes is, but it's generally a condition that results in elevation of blood glucose levels. And these glucose levels could go up due to many reasons.
Diabetes is among the non-communicable diseases which are the leading cause of deaths globally, with diabetes mellitus being the fourth main contributor.
The number of people who have diabetes has risen over time here in the country. Are there any reasons as to why we are witnessing this kind of trend?
If you look at the lifestyle that we have been on right now, especially for the last 50 years, as we have seen the numbers increase, you will agree with me that we've changed a lot. We've we've become more sedentary. That means we are not walking enough. And when you look at the life in terms of sedentary, I mean we've increased the number of cars. We are able now to do a lot of transactions even when we are seated from our own offices. And then now the types of entertainments that we also have, especially at home when you go to home, is increased to, watching TVs and basically having somebody in the house to help you do a lot of work. And therefore you end up being most of the time inactive. The foods that we consumed have been more and more refined. If you look at the introduction of things like KFC, Burger, McDonald's, and many others as are coming up, even though we tend to blame that in terms of 70 to 80%, in my own opinion, I think we have become so sedentary and still maintaining our own starchy foods that we as Africans are so much used to. And what do I mean by saying so? I mean things like chapatis. We are taking 3 to 4 chapatis and we are still not being as active as we used to be.
Diabetes type 1 refers to lack of production of insulin, where type 2 is when a body fails to respond to insulin as it should and eventually fails to make enough insulin. Both types may share symptoms which include frequent urination, feeling very thirsty, hungry, and fatigued.
Type 1 is a condition that is mainly diagnosed in young patients, that's in children, but that doesn't mean that it cannot be diagnosed even in adults. And it's a condition where the pancreas is not producing insulin. And most of the time it's what we call an autoimmune disease, where your own antibodies or your own soldiers actually start to fight the cells in your pancreas, and therefore you don't produce insulin. In this type of diabetes, type 1 results in patients actually the only treatment is insulin, as opposed to type 2 diabetes. We tend to see type 2 diabetes in the elderly, and it's usually associated with overweight or obesity. And in this case, you are actually producing insulin, and in some cases actually initially you're producing a lot of insulin and it's not working properly. And at this point, that's when we say you're having insulin resistance. So insulin resistance starts way before the diagnosis, which is a process that can take almost 5 to 10 years. And then by the time now we diagnose you with type 2 diabetes, then your insulin production or your pancreas kind of like slows down in production of the insulin. And at that point, then you present with symptoms. And even Czech Republic and many other countries are adopting lifestyle as the first line treatment of diabetes. And having worked out there and being fortunate enough, I came across a program that I call Diabetic Reversal Program that I'm spearheading here in the country. And since last year, we've had almost 100 patients come through. And all we do is to advise patients on how to change their lifestyle, how to eat properly, and what to watch out for. And with that, we've seen a lot of successes. We've seen patients losing a lot of weight. We've seen patients coming out of medication. And even some of them coming off medication and their HbA1c actually normalizing. If you're not able to come off medication, then we are seeing patients using minimum medications. And other benefits include, for example, losing a lot of weight and being able just to feel energetic, feeling yourself again. Even in terms of increasing your alertness, we've seen so many patients improve in this regard.
In 2019, over 500,000 adults in Kenya were living with diabetes. It is estimated that the numbers will triple over the next 25 years. An estimated 40% of Kenyans with diabetes are unaware of their condition.
How possible is it to manage diabetes through diet?
Very many people ask me that same question. How sustainable is it to change my lifestyle? But I ask them, how sustainable is it for you to be in the lifestyle that you're living, and on top of it you had medications? So which one is better? Changing your lifestyle, making sure that you slim out, you lose weight, you live without diabetes, and then if you have to use medication, then you're only using one or at the most maybe 2 to 3 medications to support that lifestyle. So yes, it is possible to actually reverse or actually put diabetes into remission, okay, and stay in remission forever. Or yes, we've seen patients who have been in remission and also probably for one way or the other also creep back onto the carbohydrates, and then when they creep back, they go back to their own lifestyle. And that's possible. And that's why we use the word remission is also reversible.
Where are we as a country right now in terms of handling diabetes? Are we in a better place, or we still have a long way to go?
If we look at it from a government point of view, then we still have a long way to go. If you look at the budget that was released in June, was it in June or July, you still see the allocation for non-communicable diseases, which diabetes being number one, is still at a bare minimum. So as a country, we still have a long way to go. But as organizations, I think we are really picking up. We are seeing this embracing of lifestyle change, education, and if we could now do more in terms of educating the patient and keeping the patient aware, just to make sure that they, they understand that one chapati can be 10 to 14 teaspoons of sugar, that will make a big difference.
The World Health Organization recommends the need for reassessment of funding where a greater portion of the budget is allocated to non-communicable diseases, especially diabetes. Having an accountability partner and willingness is just but one of the ways to ensure that you maintain a healthy lifestyle. In order to reduce the rates of diabetes in the country, diet management may be just one of the ways that we might need to adapt. Sada Hassan for Health Digest, KTN News.